Kansans know about struggle, about hard work, determination, and freedom for all. We've built railroads, tamed rivers and lakes, plowed the earth, and endured brutal weather, but we never gave up. In 1902, the Native sons and daughters embarked on a goal to preserve Kansas history, to honor our ancestors and instill patriotism in our youth. In the past 68 years, we've recognized the accomplishments of many Kansans as Kansan of the Year. But in 2023, we break with tradition, honoring not just one individual, but the entire Kansas healthcare system for their amazing work during the pandemic. All across our great state, they were dedicated to treating patients, educating the public, and saving lives. These are our Kansas healthcare heroes.
Local healthcare officials say the crisis is here and it is stressing the healthcare system. As we told you last night on 13 News, more than 60%.
The abundance of what was happening originally was on the coast. We knew that eventually it would be here. It's just a matter of when. And that was a very anxious period of time. Rationing care, when they talk about mobile morgues in New York City, it was very much that sinking feeling of how are we going to do what we need to do.
As an administrator, I want to make sure that I'm side by side with my medical staff. You know, we're one of 123 community hospitals and one of 82 critical access hospitals across our state, and we are all trying to do the best we can. We were all receiving a lot of information from many different agencies.
This is truly a once-in-a-lifetime experience. The students had this opportunity to see something that I had never seen in my nursing career before.
The worry of, am I going to catch something or bring something home and, impact or infect other family members?
Just made us really rethink a lot of the policies and procedures that we had, especially on the infection control side. Being part of public health, we had a large amount of information that was available to us. So we were able to kind of ascertain where we could go and where we could stay safe without gambling too much, because in all honesty, we were on the cutting edge and didn't know what exactly was going on in terms of the whole COVID epidemic.
And it was probably the most intense time in my entire career. I know how it felt to manage family members who were very upset that they couldn't be there with their loved one when they were extremely sick in the hospital. We were looking for creative ways to be there for that patient, but it's not the same.
This was the first time we had a major healthcare crisis like that where the information was shared real time, the research, the data. Science is percentages, whether it's a masking or the vaccines or whatever, and typically all that stuff happens behind the scenes, the peer reviewing, everything that it takes to go through that. And then you sit down with your doctor or PA or nurse practitioner, your trusted medical provider, and they boil it down to something you can understand.
And we were very stunned when it became apparent to Kansas Community Health Centers we were going to be responsible for getting the vaccines to all the medical providers. So they sent it all to us, and we had to figure out how do we don't have contacts with all the optometrists and dentists and physicians who don't see patients in the hospital.
We ended up originally with small amounts of vaccine and not really knowing when you were going to get them. Then if you try to anticipate filling a day's worth of vaccines with people when you don't know when the vaccine's going to be there, it was very much mind-boggling. There's a lot of pharmacists that put in a lot of extra hours, not only giving vaccines, but just the clerical aspect of making sure people's records are accurate.
We vaccinated providers and employees first, and I'll never forget that, just the joy and the relief. But also the first public person was about a 99-year-old woman that I would see in church every Sunday in her own pew. And here she was getting the vaccine, and just that relief and the joy that she's probably going to survive this now. And that's the personal impact that I know healthcare providers across the state of Kansas had in caring for their communities.
During COVID, I worked in the surgical trauma ICU. At the peak, we were caring for over 100 COVID patients. Being in the unit we were in, the traumas didn't stop, emergent surgery needs didn't stop. For the healthcare workers, they were just living it every day and seeing the impacts that it did have. Maybe holding a patient's hand as their family members couldn't be there.
It's a hard profession because it not only requires a skill set of science, but also the art of empathy.
Now that we're on the other side and looking to what is ahead for the future, I let the new grads know you just lived through the worst thing of your career. Now it's only going to be better.
But we know people really saw burnout, and they saw challenges, and they saw a lot of hardships. And we have to continue to tap into the health needs we need physically and mentally.
We did receive a lot of thank you cards. To me, that means a lot. Everyone who participated, they were, in my eyes, a hero. And for me and the team I was working with, I have goosebumps right now, even thinking about what we went through, how we supported each other.
From the individuals that are in the facilities management side of the work, making sure everything is sterilized and clean, to the folks that keep it secure, to the individuals that provide bedside patient care. Every single person working in a healthcare facility really contributed to us being able to provide the best patient care during this pandemic.
And that happened in our facility, Lynchburg Community Hospital, and it happened in facility across the state, and I know around the world, frankly.
Well, I think Kansans have always had about them the ability to make things happen against adversity. The ingenuity of the community has always come through, no matter what the situation was at hand.